At MedStory, we take privacy seriously and follow all healthcare privacy laws. Some details may be changed to protect confidentiality. The views expressed are solely those of the individual speaking and do not represent the views of their employer.
Okay, before we dive into this incredible episode, we do want to share that we have just launched MedStory News, and we are currently looking for expert contributors. Right now, you have to be a licensed physician in the United States, and we are talking about all of the trending things within healthcare in order to help fix this broken system. So if you're interested in becoming a contributor, please go to MedStoryStudio.com to learn more. Okay, let's begin.
The average primary care physician in this country, with the typical patient panel, they need 26 hours per day to get their job done. I can feel very hopeless with, it doesn't matter if I do right or do wrong, like there's no winning in this situation. I understood that those changes really can cost lives, and it didn't feel good being a part of a system like that. I created a practice that honestly, there's no other practice I can identify in the country like it. It still gives me chills to say that.
Welcome back to the MedStory Podcast, where we share the stories of the greatest minds in science and medicine. Today, our guest is Dr. Michelle Cooke, and this is an amazing conversation. She has just been named the DPC of the Year, became a published author, and has launched the first DPC clinic in the entire country designed for Black women. This is an incredible story. Let's begin. Dr. Cooke, I want you to tell me, when you first decided that you wanted to become a doctor, what did you imagine being a doctor was going to be like?
Oh, I had no clue. I had absolutely no clue. So I came into medicine. I think it's important to understand I'm a first-generation doctor. So I'm the first in my family to get there. And so I had very little guidance. But what I was a smart little girl. I did well in school. I could ace my classes. And so when you're smart, what do you become? You become a doctor or you become a lawyer. So I'm the doctor and my sister's the lawyer. And I knew, really the only thing I knew was my own pediatrician. And I really liked her. It was fun going to visit. Sometimes it wasn't so fun because they would give me a shot or I'd have to draw blood. But I thought you were kind of a doctor that helped people. And so that was the only really concept I had of medicine. I saw some TV shows where they worked in the hospital, but I'd never been hospitalized. I didn't really know what it looked like behind the scenes. I just had very little understanding. I was so clueless, in fact, that after I got admitted to med school, I didn't even know you had to do a residency. I really thought it was, you go in, you graduate, you're a doctor, you just start seeing patients. I'm like, wait, there's this next step. I was so clueless. So my family was very excited for me. They wanted to cheer me on, but I didn't know what I was getting myself into. So I think there was a lot of ignorance fueling my path into medicine. And maybe had I known more, I would have thought a little differently. I can't say I wouldn't take the path that I took now, but I did not know what this was going to look like. I just knew if you were smart enough, you could get into med school and you could become a doctor and you could help people. But that's really all I knew.
So it was more of just knowing that you could go one of the two ways. And then, but what made you decide to go doctor over lawyer?
Law school felt like way too much reading. I thought about it for a while, but it just felt like way too much reading. And then as I got through middle school, I had some really great mentors. They talk about not a lot of women going into the STEM fields. And I remember having a teacher named Aaliyah, and she was my math and science teacher. And it was one of the first times I'd ever seen a Black woman in doing STEM, like teaching math, teaching science. And I just had such a great time. And it was a pivotal point for me to saying, oh, I guess I can do math and science. I never thought I liked it before. But algebra started making sense and biology seemed kind of cool. And I was like, oh, I kind of like this idea. The other thing that was cool was that I think I am a people person. And so it was awesome to be able to find a field that could marry both of those, where I could use the applied sciences and still have this very human connection. So I was attracted to medicine for that pathway. I can be conflict averse at times. I've had to confront that because it comes up in medicine, but my perception of the law field was it was very conflict heavy. And I didn't want to go into something that just seemed super high conflict. My sister's a scrapper, so she's right where she needs to be.
So you decided to go on throughout this, and then you get through medical school, and then you finally become a doctor. What you had imagined?
Not at all. I mean, I didn't really know what to imagine when I first got in. When I went to medical school, I went in saying I wanted to be a family doctor. Again, still not really understanding what that meant. And I just know that I didn't really want to be in the hospital too much. I liked being outpatient. I liked having conversations with people, guiding through health, teaching. And it seemed like family medicine did that. What I didn't know about family medicine is how broad it is. And I think it's an amazing specialty. And I think the best way to explain a family doc is to think about if you're in a rural community and there's not a doctor for 250 miles, your family doc is it. So they have to know something about everything. You treat cradle to the grave, you're delivering babies, you're caring for those babies, you're taking care of moms, you're taking care of children, you're taking care of adults, you're taking care of elderly, you're doing some small procedures. Someone cuts themselves, you've got to know how to repair it. And some communities are doing even more advanced operative procedures like C-sections and gallbladder removals and all of that. So you're kind of that jack of all trades. And so I didn't realize the breadth of what family medicine entailed until I got deeper into it. As I was going through medical school, every rotation, I could see myself in one of the specialties. So, like, I was like, "I wanna do family," and then I did internal, I'm like, "Oh, this is cool, maybe I could do this," and I did peds, I'm like, "Oh, this is kinda cool too, maybe I wanna do that." The one area that I really loved, and it was very difficult for me to choose between family and this specialty was OBGYN. I loved my OBGYN rotation, thought it was amazing, loved working with women's health, delivering babies was so much fun for me working on women's health in the outpatient, like I really had a hard time deciding. But the one thing I know I didn't want to do was surgery. Like I just know I'm not a surgeon. The OR, while some people love it, it felt like prison to me. You're in the sterile field, hands between your hips and shoulders. You can't really move. It was not a fun time for me being in the OR. And so choosing a specialty that was half operative was just not a great option. And so again, I had some more mentors. I actually had a mentor who was OBGYN turned family medicine. And she really guided me away. And she's like, OB is wonderful. She's like, but I'm not going to lie to you. It's a very challenging specialty for women. If you see yourself having a family, if you see yourself wanting to be involved as a wife and a mother, this is a very, very tough field and it's really hard to make it work. I had another mentor tell me, go into the field, not where you've had the most fun, because catching babies can be a lot of fun, but where your tribe is. And I've never forgotten that, meaning where are the people that think and live like you, So are they married? Do they have children? Do they value being at their kids' sports games? Do they love talking to people, value relationships? And every time I thought about that, I always stood out with the family doctors. Like they were my people. They really believed in family first. So yes, they were very crazy about taking care of their patients, but being good stewards in their home, good husbands, good wives, good fathers was equally important to them. And I did see that in other specialties. But again, when I was around the surgeons, like it was surgery or nothing, life was often put on hold or pause. And I saw a lot of family relationships suffer in those type of careers. So I do think there are docs that make it work. But I think when you go into some of those operative specialties, hospital-based specialties, it can be just that much harder. And so for me, my tribe was family. I was actually pretty glad after I got deeper into medicine to give up delivering babies because as much as I love them, I really love my sleep. And babies come all night long. They're just very disrespectful with your time. And so I'm glad not to be in the hospital delivering babies in the middle of the night anymore. But what I was able to pull from that is now my practice, even though I'm a family medicine physician, is focused on women's health. So I never had to let go of that aspect of being able to care for women at all stages of life. And so I still think I made the right choice. It took a lot of wandering to get there, but I'm really happy with the choice I landed at.
It sounds amazing, the idea of you as a doctor having some sort of balance where you can actually spend time with your kids. However,
Right,
I'm sitting here and I'm hearing you say that, and it just doesn't match up with my experience as a patient in the healthcare system. It
right.
always feels that my primary care doctor has so much on their plate.
Yeah,
And I can't imagine that they are taking care of everything they need to take care of within that whatever 8 to 12-hour shift. I mean, is
right.
that the reality?
Absolutely. Absolutely the reality. And I think I got to see a bit of the shift. I mean, there's so many factors into what has made, I think, medicine in the US kind of impossible, but particularly primary care. So I graduated medical school in 2011, I think it was. So I came in the mid 2000s. I was actually part of my hospital system as they were transitioning from paper charts to electronics. I got to see that change. And that was a major impact, because you could kind of scribble things down. People hated hated it because doctors' handwriting is so bad. But you could kind of scribble and move, scribble and move. And now we all had to get plugged into this technology. And while I think for documentation and filing purposes, the technology was wonderful, it slowed everything down and added a layer of being so cumbersome that it took a lot of the personal connection out of medicine. And so I remember watching that happen. So when I was going into medicine and looking at my mentors, they weren't really navigating, dealing with an EHR and patient portal messaging and all that stuff that just kind of makes it very, very hard to keep up. They weren't clicking boxes for meaningful use. And so then as I went through residency and it became more standard of care to have an EHR system, the impact on medicine was astronomical. There was an article that came out recently that said with the introduction of the portal, they were hoping it was going to decrease or balance out patient care time by giving people another way to contact their physicians. But what we found that we've actually added to the physician load, I want to say 150%, I'm going to get the number wrong. But rather than decreasing patient visits, it made you see more patients throughout the day and then still have this inbox that you had to handle afterwards. And that's where I got stuck, where, you want to do great and see your patients. That's where the revenue happens. But then you have this whole job outside, which is the inbox, which can take hours to get through between your refills and your callbacks and your lab results and your patient portal messaging. And it felt like you were doing two jobs every day. There was another article that came out by, I want to say it was the University of Chicago, that said for the average primary care physician in this country, with the typical patient panel, they need 26 hours per day to get their job done. 26. And when I read that, it made so much sense and I felt so vindicated. And I thought that this was going to be the article that changed everything. And nothing happened. People read it. They're like, oh, no, do you not understand? This job is literally impossible. To do a good job, you need 26 hours and nobody has that. And so again, I never forgot that article because it just affirmed everything I was feeling, that there's no way to keep up with all the work that we have. And I think when you want to be the type of doctor that spends time with your patients and has meaningful time, it is only that much harder because efficiency and speed becomes rewarded in a way that relationship building and spending time does not.
What are you feeling when you want to provide this quality care, but just the demand is too great? What's going on in your head?
It, I don't know if I guess the best word that I can find, when the book came out about moral injury, I think that best described it. Because I'll speak for myself, felt so torn between trying to be a good doctor and work ethically and balance it out against everything else in work and in my life. Meaning that if I spent an extra 5, 10, 15 minutes with a patient, that meant I left another patient waiting. And that buildup happened. So pleasing somebody or doing the right thing somewhere meant something bad was happening elsewhere. And having to live between that all the time it just feels like a no-win situation. And I see why doctors just feel like there's no win. There's a better word I'm looking for, but I just can't find the words right now. But I remember that feeling like if I was showing up for my patients, I left people waiting. Sometimes I would get in trouble because staff was staying too late. The overtime hours were building up, so I was getting slapped on the wrist because of that. And then your home life, right? I had a son at home who would waiting until 9, 10 o'clock for me to come home and have dinner, or my husband who'd been waiting for me. So every time you felt like you stepped up to do the right thing, there was always a cost that felt like it wasn't always worth it. And so it can come to a point where it feels very hopeless, very hopeless. And I hate to say stuff like this out loud, but I think it's important to say I totally understand why physicians are now the number one group who's at risk of suicide amongst professionals. I think it was lawyers for the longest time, but I see where you just get to this point where if you do a good job, you get punished for it. And if you do a bad job, you get punished for it. If you are shortening patients and being curt with people in short, you get bad reviews and people don't like you. But when you do the right thing, the cost there is also extremely high. And so it can feel very hopeless with, it doesn't matter if I do right or do wrong, like there's no winning in this situation.
Is there a moment that sticks out in your mind, like a memory of where all of these factors coming in and just feeling overbearing on you? Is there a moment that sticks out in your mind where that kind of was present?
There were way too many moments. I mean, there was moments where I think one of the worst moments was I had a patient that came into the office and I was just completely overwhelmed that day. I remember just that feeling of panic and there was too many people to get through and people are in the hallway looking for me. And something about this man just did not look quite right to me. And he had just gotten out of the hospital. He wasn't feeling great, and I was trying to put his story together. I don't recall all of the details. But, it was a hospital follow-up, and he just didn't look like he was significantly improved. And sometimes you get out of the hospital, you still have to, some time to recover, and so I remember giving him a little extra time off work, but just not feeling good about his situation, but also knowing that I really didn't have the time to dig in to figure out what was wrong or what was going on. And I came back to work the next day or maybe 2 days later, getting a call from his wife that he had transitioned, that he had passed away. And I don't know all the details of why he passed, but I remember never feeling good about that because I had that feeling that day, like, something's wrong. I need more time here. But when people are beating down the door, the nurses are like, you need to get into this next room. I did not have the capacity to spend with him. And it never sat well with me. And as I worked in a large healthcare system that kept asking me for shorter and shorter times, I remember the transition. We went from 20-minute patients' appointments to 15, and I fought tooth and nail. And they said, no, Dr. Cooke, we need to standardize the schedule for all physicians. There's no way we can give you that extra 5 minutes you're asking for. This is the way it has to be. And I understood that those changes really can cost lives. And it didn't feel good being a part of a system like that. So that was a moment. I remember, I talk about this in a podcast I have, working in this type of really high pressure environment. The only thing that kept me going was taking breaks. I very much look forward to vacation. Every quarter, there's something on my schedule that I can work towards. And I had no control over my schedule. And so there was one point where I had booked a vacation. It was 4 months ahead. And I told the administrators, block my schedule. I'm going to be gone because people were already booked on the schedule. There were about 10 or 12 patients on the schedule 4 months out. And they're like, we'll take care of it 3 months in. Please remove those patients from my schedule. Nobody can do anything. I can't touch it because I don't have that authority as a doctor. 2 months in, there's still patients on my schedule. And I got to the vacation and all those patients were never moved from my schedule. So I go on vacation, even with this in my mind, like I can't fully relax knowing that there are these people that shouldn't be there and they're going to be told that their appointment's canceled. And so I get back and what happens is the inevitable. And they say, Dr. Cooke, we didn't get a chance to move your patients, even though I have record of 4 months ago you asking to do that. And we're going to have to cancel them. And the next appointment is 4 months out. So what happens? I look like the bad guy now, right? My patients are sending me a message on the portal, Dr. Cooke, I booked this 4 months ago. I'm getting canceled today. Why can't you see me? I need this done. I need that done. And they were absolutely right. But I had no control over how the system worked to be able to show up for them or give them the fairness that they deserve. And I remember that was a huge breaking point because I remember thinking if vacation can't be restorative, there's no way I can keep this up. It felt like abuse. Every day felt like a bad day. I said I was either going to have a bad day or a worse day, and I didn't know which one it was going to be. But after that, it's like if I can't recover from vacation, like there's just no way that I can continue to do this for the rest of my career, because going on vacation felt like punishment. And so there were just so many times where these types of things would happen, not having enough time when I needed my time respected, it wasn't respected, and so it just felt like a no-win.
I think it's really important just to take a moment and really identify this experience for you. First, with the man who came in, and you not really having the time to truly evaluate him because
Right.
of the demands on the system. That's a huge burden to wear.
Huge.
And to think that you had to go through that, you had that, and then you show up to work the next day, be like, hey, you got another 20 to 30 patients to see. So what is your options here, right? You either shut down, you try to
Yeah.
process, but you can't because you're trying to be present for the next patient that comes through your door.
Right.
And we
Right.
think that, we think
It's
that you guys can do
impossible.
it. It's impossible. It is,
Yeah,
right?
the emotional weight of dealing with that, like you said, and seeing that next patient is so getting that phone call and knowing I still have a day of patients to see. And the one situation I can link it to, and you're gonna remember this better than I do, but within the past year, 2 years ago, we all witnessed the cardiac arrest of that football player. Do you remember that game was happening and that case happened where there was an arrest on the field? And the game stopped, right? It was done. Everybody went home. It was over. What we witnessed was just so heavy to process. Unfortunately, that player made it. But as physicians, these happen all the time. People drop dead. We're told about that, and we can't just stop and walk away. And I think when the world witnessed that, they needed that time to process. People had a really difficult time with what they just witnessed. And we witness those things way more often and don't have that time to process. And so, yeah, you do start shutting down or forming layers or getting these calluses that you never wanted to form because that's what's required to just continue throughout the day. But the weight of it is impossible to carry.
Do you think that ends up impacting your clinical judgment moving forward?
Absolutely. Absolutely, and not in a good way. I think it makes you more paranoid. I think it makes it very difficult to think clearly. I think we start practicing much more defensively. We're not willing to hear people or even take a little bit of risk where risk may be appropriate for the right patient or deviate from treatment plans that may be appropriate for the patient because you're trying to avoid ever having to experience that moment again.
Hmm. Okay. Now I want to, because this is a good transition point here. I want you to tell me the story of when you were let go at your job.
Absolutely. So it was shortly after that vacation period. I remember when I came back from that vacation that my time wasn't booked. I remember going to my husband and saying, I'm not doing this anymore. I'm leaving. This happened probably, it was in the summertime. We usually take our vacation around our anniversary, which is in the middle of the summer. And I said, I'm going to be out of here by Memorial Day next year. That's my timeline. I'm getting out. I really can't do this. I had heard about direct primary care, and I was like, there are these cool doctors doing this crazy thing where they spend more time with patients. I don't use insurance. And I'd had my eye on it for years, but never felt brave enough to jump into it because I had no business background. And so I just didn't think I was smart enough to pull it off. But that was a breaking point for me. I was like, I can't stay in medicine like this. So we crafted this timeline. He was very supportive of me because he was watching his wife crumble, before his eyes. He talks about watching me cry in the bathroom before I would leave to go to work, or he knew I was sitting in the driveway a long time after work because I was just processing and didn't want to bring that into the home, and it just wasn't the relationship that he wanted to continue. Remember, I'm a first generation doctor. My husband, he's a PhD, but he's first generation as well. He's like, look, we come from the sticks, right? We know how to be poor if we need to. This is not worth it. I'd rather be in the poorhouse with you than, trying to make this money and, be in these careers at this level. So he was very supportive. But what happened probably about 2 months later was incredibly shocking, but also made so much sense. And what ended up happening is the hospital system that I worked for, there was this major hospital system, and they have multiple regions that they cover. And Atlanta is one of the regions that they cover. And they decided that in Atlanta, and they've never been fully transparent about the closures, but suffice it to say that the region was not making enough money with things like poor insurance reimbursement, poor payer mix. You hear that all the time, like too many people with Medicaid, Medicare, and too many uninsured patients, that they were just hemorrhaging money. And so they closed 2 hospital systems that are critical and vital for the infrastructure of the city. One of them is the hospital that I actually trained at. That was where I trained to become a family physician. It's where I gave birth to my son. It had been in the community for more than 100 years, so very huge, important safety net style hospital, gone. There was a second hospital in the Atlanta region, technically in the city of East Point, where my practice currently is. That was its sister hospital, again, serving a large community, one of the blackest communities in Atlanta, and shut down overnight. So we lose 2 hospitals in the span of about 4 months. And the underside of that story, because people kept watching the hospital closures, and that was what they had their eye on, but they were closing all the outpatient and ancillary services too. So all the primary care offices, all of the specialty offices, like all of us got termination letters saying that, we're closing down this practice. You don't have to go home, but you can't stay here. We were going to be offered positions in other parts of the system, because remember, it's a large system. It's serving other counties in the Georgia area, but they just were not going to be operating in Atlanta anymore. And for me, it was a terrible day in my career, but it was also one of the most liberating days of my career, because in my head, I'm like, this is not working and this just doesn't make sense. How am I so busy? How am I seeing 20, 30 patients a day? How do I not have room to breathe, but yet we're hemorrhaging money? Like, how are we this busy? There's this much demand, but somehow it doesn't work. And again, I'm not that business-minded person, but I was like, if you have this much demand, and you can't stay afloat, there's either fraud going on somewhere or this is just a very poor business model. And I took I think both of them are probably true, but I really think it was a poor business model. The way that we're engaging and using insurance and needing all this bulk to be able to make healthcare happen, I just didn't think was sustainable. And clearly it wasn't. So in my community, we lost these incredible hospitals. I don't think we're going to recover from this in my lifetime. But getting that termination notice gave me the freedom to say it's time to do something else. So this happened in September of 22. So I had that terrible vacation the summer of 22. By September, around Labor Days, when I get this letter, and then I'm out of the system by November. So I was hoping I'd have until Memorial Day the following year, but that timeline got sped up rapidly. So I had to really move closely. And by Memorial Day the next year, I actually started my own practice. So it was very, very difficult. It was very, very painful. But in some ways, again, it gave me permission. Even though I was planning to leave, I think one of the hardest things that doctors that leave the current or traditional system, I think one of the most difficult moments is making that declaration, putting in your letter. And I never had to do that, and I almost wonder, would I have been brave enough to do that? Like when it really came down to it, would I have actually submitted that letter? And this meant I didn't have to. So it kind of gave me the freedom to move on to the next step.
Wow. And so as you moved into this transition from, big corporate medicine to your own thing, that's scary because there's no
Super.
guaranteed revenue or income at that point. Tell me about that process. You're like, okay, I found DPC, direct primary care. How did you decide what your business model is going to be? Like, what was from ending your job to opening your clinic? What was that timeline like?
It was wild, and I'm so glad I had it. And it's hard to put into words, but I think you just keep iterating until you get there. So a couple of things did happen that gave me the runway to do this. The first was, I was terminated, which effectively, even though there was still some nuance there, freed me from my non-compete clause because I wanted to stay in the community. So there was a lot of nuance there. They wouldn't technically release me, but I was able to negotiate to let go of that non-compete. So that was check number one. Check number two is I was able to complete just meeting 10 years with that institution, which was technically a not for profit. And I was able to get the remainder of my student loans forgiven. So, had that move not happened, it really would have put me in a very difficult situation. But, I had this financial runway of, ooh, you have a couple $1,000s you can hold on to every month that you're not paying any student loans anymore. So, I was able to qualify for that. And that was huge. And I would say the third thing, and probably the most important thing, is I had a spouse who was incredibly supportive. I think if my husband weren't on board, it would have been that much harder, but he was behind me because he watched what I was going through and he was like, "This is not the life that we signed up for." He's like, "So, like I said, if we have to go back to the poorhouse for you not to be crying in the bathroom before you go to work every day, let's do it." So he's been incredibly supportive. So then I had to just do a lot of working on my mindset. I kept telling myself the story of, I don't know business, I'm going to fail. I've watched all these private practices go under or get gobbled up by a corporate system. How on earth do I think I'm going to stand in this community? And I learned about direct primary care. Again, I learned about it at a medical conference probably about 6 or 7 years before, and it just never left my mind because I was like, wow, this is amazing. And so I really leaned in and I bought all the books. I talked to some other doctors in the area. I listened to the podcast about direct primary care. And in the last month that I was with my healthcare system, I went to a conference called Nuts and Bolts, which is a conference that helps physicians start their DPC practices and connect them with other physicians who are doing DPC. That was such another pivotal moment for me because medical conferences, I love attending because you get to learn something new. But if you've ever been to a medical conference, they're kind of miserable. And because most physicians are miserable, so they're there and they're like, oh my gosh, I still got 40 charts left to do. I can't wait to retire. How are you guys getting out of medicine? Everybody's mad. They're there, but they're not really there. It gives them a little bit of a break from the day-to-day grind, but they're still stuck in that day-to-day grind. And they called the Nuts and Bolts conference the happiest CME on earth. And I was like, it actually kind of is. There were doctors exciting and they're innovating and they love seeing their patients and they have time with them. Everything I thought I was going to get out of medicine, they showed me that it was possible. And so once I got the hint that it was possible, there was really no reason why I couldn't do it too. So there was a lot of mindset shifting. And one of the things I had to keep telling myself is, even though this is hard, I am a whole physician. I went to medical school. I went through one of the most grueling processes that any professional could ever go through. And there are people who are way less credentialed who have successful businesses. There's my lawnmower guy, there's my hairstylist, there's all these people who've never had to do half the education I have who are running successful businesses. And what makes their business successful? Usually the simplicity. You perform a service, you get a payment. That's it. And you can build off of that. Where I think medicine gets crazy is you perform a service, you submit a bill, you get a code, you negotiate, it gets marked up, marked down. Maybe you get paid, maybe you don't. Maybe you get paid and then 90 days later they snatch it away. It's so much instability when you involve insurance in that process. And as I learned more about the healthcare system, it really made sense to me to separate the insurance model from primary care. And when we can take it down to the bare bones of just being a business, just here's my service, here's my price. If inflation goes up, I can increase my price if I need to. If somebody's having a hard time, I can waive their membership and not be charged for fraud. It just brings simplicity to the exchange, which to me just made so much sense. So I did work with a business coach for the first year and a half I was in practice to make sure I was just, checking in and kind of confronting a lot of the limiting beliefs I had about being able to start a business, connecting with other physicians, keeping that community going, and brick by brick, we were able to open the doors.
Do you remember either the first person signing up or one of the first patients that you actually got to see under your own business?
Yeah, it was awesome. I mean, so in some ways, because of that closing, I had a huge level up because even though I was impacted, think about the way the community was impacted. I'd been there for nearly 10 years at that point, or no, about 10 years because I was able to qualify for that forgiveness. And so there are patients who've been seeing me for years and suddenly I'm gone. So it really rocked them too. And so I made an effort to try to stay in touch and be present on social media and getting mailing lists and let people know what was going on. And so before I opened the practice, it was tricky because I knew what I wanted to do. I'd seen it done, but it's really hard to sell people on something that you don't really know exists yet. It's kind of like, here's how it's going to work and here's how. And so I had all these ideas, but I really never did it in practice. So it was very difficult to market and sell yourself when you have never done it before. But prior to opening my practice, I stayed in touch with people, let them know what was going on. And I had this opening event at the local library. You talk to these other business owners, you find out what are cost-effective ways to connect with your audience. In the library, you can rent a room for free as long as everybody's able to go. So I rented a room from the library and invited, and I had probably almost 50 people show up to that event, which was remarkable. And I did a presentation about what I was up to and why I was doing it and why I thought it was going to be better. And that day, I opened up my pre-enrollment list. So everybody that went to that library event got the opportunity to be the first ones to enroll in the practice. And so from that event to before I opened my doors, I had about 60 people who pre-enrolled. So that was amazing to know that I wasn't going to be starting completely from scratch. And so all of those initial patients were patients who had been my patients in the previous system. And many of them are still with me till this day. But having them come with me to the other side, I was subleasing a space from another doctor. It was very bare bones, but they were just so excited that I was still in town. I was still available and to sit in that room with, just a chair and my desk and be able to just practice great medicine and not necessarily need all the fancy, shiny stuff that you get when you're in big corporate medicine, but really just bring it back down to brass tacks.
It's amazing. You're using some textbook business and marketing strategies, and you probably were aware of it at the time, but it's so brilliant because every business has the problem of finding leads, and
Yep.
then it's turning leads into clients, and then
Right.
from there you get to serve them. And you
Right.
did it within an extremely beautifully simple way.
Yes, had to learn so much about marketing, and I think that is really shocking to a lot of physicians that go into this model, like how much it takes to be able, like you said, to generate those leads and have them become eventual patients and customers. I think because when you work in these large corporate systems, you kind of feel like there are patients everywhere. We can't stop them from coming. And so I think there's a mindset of if you build it, they will come. And we've learned that that's not true, right? You can build it, but if you can't sell it, if you can't explain the value proposition, they are not going to come. And some of these practices may not do well if you're not willing to engage the community in the right way and nurture those leads. So I had to learn a lot about marketing and sales. But I definitely had that thought too, because before I left the system, there were over 3,000 people who were part of my panel. So when I finally got the numbers, there was 3,000, which is ridiculous because there's no way, I don't think I had 3,000 appointments in a year. So I wasn't serving everybody well, sending people to urgent care, all of that. But I kind of thought, well, in this DPC model, I only need 500. There's 3,000 who I'm already their doctor. They're all going to follow me. I wouldn't have to market at all. And that's not what happened. I got that 60 pre-enrolled. Some of them have left, since then. But building to where I am now, and to just disclose, right now I'm just over 300 members. I have to look back to see how many people have actually been a part of my membership, because last year we found that we had lost over 60 members. We replaced them faster than we lost them, but there is that churn that happens where people don't necessarily stay with you long term. So how do you make up for that? How do you keep getting patients into your practice? But I just thought, I'm going to be here in the neighborhood. From 3,000, I'll be turning people away because, because I only need 400 to 500 to make this work. And I didn't think I was going to have to work that hard to bring them in. And boy, was I wrong. So I really had to study a lot more about marketing and sales and retention and all those things to be able to make it work.
Yeah, for sure. And I think that's what transitioning from provider to entrepreneur is a big shift, right? Because you're not taught any of that. And you think I shouldn't have to sell. But it's really important to reframe the way you approach that. It's saying you're selling a service because you're significantly making their life better and you're giving them better quality care, right?
Right.
And that investment in themselves is something that's going to be beneficial. So it's okay for you to go out and market yourself and sell that product to them.
Yes.
You
And you feel, you're taught to kind of feel slummy or sleazy for doing that. There's certainly this mindset I had about doctors when I was in the system. Oh, they're having to sell themselves, or look at these doctors pandering on social media. You kind of have these thoughts about them, not realizing that your little ivory tower is propped up by a huge marketing system with the organization that you're a part of. And you don't realize how much work is happening behind the scene in terms of that patient acquisition in order to make it work. So it's very humbling when you make that transition, but it's doable and it's certainly learnable.
Talk to me about that sales process really quick. So I come to you and say, Dr. Cooke, yeah, I'm interested in it, but I already pay for insurance. Why would I sign up for this?
Absolutely. So to your point, being able to explain the value, and I would say the book to me that has become the Bible for my process was, and of course on the spot, I can't remember it. The one-page marketing plan, Alan did. So that one, I always refer back to that one. And it helped me a lot on a lot of things. It helped me a lot with mindset about, developing a niche, knowing who to serve, creating your patient avatar. I got all of that from that book. And I really orient all of my marketing and sales towards that. But what were some of the things I learned from that? One is that not everybody's going to be your patient, and that's okay. And I think when you start these practices, like any business owner, you're desperate. You're like, I have the best thing ever. Join now. Like you kind of come really hard and people are like, whoa, I didn't even ask for this. But I remember in the book, they mentioned at any given time, only about 3% of people are ready to buy or make a decision, right? So you're going to have to talk to 100 people to get 3 people to sign up. And that was very scary, but it made a lot of sense because it took that pressure out of feeling like every interaction had to be that one that you converted. I was like, realistically, only 3 of them are going to convert for every 100 that you talk to. So what you need to get good at is being identify who are the ones that are going to be more likely to convert. Because if you're talking to everybody, you're talking to no one. The other thing it taught me is really understand who you're serving. So remember, I'm a family doc, and I kind of love being a bit of everywhere, doing a bit of everything, and serving a bit of everybody. So the idea of kind of narrowing down the patient population I wanted to take care of didn't always sit right with me because I'm like, I'm a family doc. Anyone, come one, come all. I take moms, babies, old people, young people, like everybody's welcome here. And that's still very much true. But from a marketing perspective, I always remember that if you're speaking to everyone, you're speaking to no one. So know who you're going to talk to. And when I really sat back and gave myself permission to build the practice of my dreams, I knew exactly who I wanted to serve. And I've always wanted to serve basically myself, women like me, Black women who feel underserved in medicine. And it's like, that's who my patient avatar is going to be. This is going to be a practice for Black women. And everyone's welcome to come. As a Black woman, we do not believe in discrimination. We know how harsh and how painful that is. And so when people sometimes hear that I have a practice that is dedicated to Black women's health and wellness, that's what it is. But some people hear this practice is against everybody else or against white people or against men. It's like, no, like you can be for something without being against, but this is who we really want to uplift here. And as long as you're okay with our mission, you're welcome to come along too. And so when I gave myself that permission, it really changed everything because I created a practice that honestly, there's no other practice I can identify in the country like it. So we are the first direct primary care practice dedicated to Black women's health in the nation. And so it still gives me chills to say that, but that's exactly what we are. But when I got that right, it made it easier when I went out to talk to those 100 people where only 3 was going to convert. I knew who I was looking for. I'm looking for that Black woman who feels left behind. I speak to everybody, but that's really who I'm calling out for. So I do on my social media, all that stuff, I speak to them. You talked about how to talk to people who say, if I have insurance, why would I sign up for a service like this, a direct primary care where it's membership based? Again, I had to let go of that ego as I'm not going to be for everybody. So where I got to it, I was like, you know what? If your insurance is working for you, I'm happy for you and you don't need me, and that could be the end of the conversation. But for many people, they have a million complaints about their insurance. I can't get into my doctor. Nobody calls me back. They keep canceling my appointments. I'm getting all these surprise bills. So if you learn what their pain points are, and if I think I can serve those pain points, I will speak exactly to that. But I may ask, do you feel like your insurance is falling short? Are there things that you're frustrated with? And let's see if we can try to help each other. But if there's a person that comes and say, hey, I see my doctor once a year, I have insurance, I'm happy, that's probably not my patient, and that's okay. They have a situation that works for them. I'm not going to be able to serve them well. So I wish them well, and that's great. But learning what those sales cues are about, okay, do they have a problem that I can solve?
This is what you're sharing is actually a true masterclass on how these conversations should be having. Because number
Mhm.
one, you should feel good about the conversation. Number
Right.
two, it's extremely powerful to say, "Hey, it sounds like you're good. Like you don't need me." And
Yeah.
immediately that's gonna put their walls down. But
Yeah.
if they say, "No, I'm not actually happy," then you ask, "Why? Why are you not happy?"
Right.
And then they start to reveal all of the pain points of why they're actually sitting here and having this conversation. And then you can say, okay, well, maybe my service is the bridge for you, right? To help
Right.
you overcome those pain points and get you to where you want to be. Um,
Right.
and there's tactics in that. There is, but it's more of just having a conversation human to human and seeing if there's a mutual
Exactly.
understanding and then moving forward together.
Exactly, and that's exactly the approach I've taken, and I've also added to that, just always try to be helpful, even if you feel like you're at the expense of it, right? One thing that would happen all the time, and it drives me nuts, is, like, I'd have former patients call the practice and say, "Well, I know that Dr. Cooke is, doing this membership model, but can you refer me someplace that takes insurance?" And I was like, "Why would you call my practice to go someplace else?" Right? And so I didn't wanna be sending business away. I'm like, "Okay, well, why not consider this service?" But if that's really what they want, I'm gonna let them know, "Okay, here are the top 3 doctors I would recommend, with insurance, go ahead and see them, and hopefully they can help solve your need." And I used to hate doing that because I was like, "Why are they calling me to go give some business to somebody else?" But what I've learned from that is people never forget the way you make them feel, and if they feel like you have helped them, many of those people would refer people to me later. Right now, I can't go to Dr. Cooke because I really have to use my insurance, but oh my gosh, my cousin just lost her insurance. Let me send her to Dr. Cooke. So you plant those seeds, and sometimes it can take months or years for them to germinate, but sometimes they come back. And I've had that happen so many times where it's been like, just be helpful. And when people know that you can help and solve their problems, they're going to refer other people to you. So just always trying to find a way to be helpful and solve their problem, even if you aren't the one that can solve it.
I've always appreciated that when I've had conversations with you. You're always trying to provide value. You're always trying to connect people together. And it's infectious. It really is. It's like,
Yeah.
oh, I want to spend more time around this person. And
Yeah.
genuinely, it's like you being yourself, which is amazing, right?
Yeah. Yeah, and it feels good. I mean, it feels good in a way that I feel like it was hard to feel good when I was in the system because it felt like doing good always had this bad underside to it, so you're just very afraid to, but to do good and see it show up in other ways or, a patient come to me a year later saying, "Hey, my cousin said you referred her to a doctor, but you might be the best doctor for me." I'm like, "Wow, like that seed actually landed somewhere and here I am able to help somebody." So, it feels good to be able to live in that space where you feel like you're adding value to people's lives, even if it doesn't directly, add value to my bank account, right? It's like you're helping the world. So that makes a big difference for me.
Are you busier now as an entrepreneur than you were as an employed physician?
Probably. It's just such a different type of busy. It is such a different type of busy, and I still struggle with how to describe it. So I feel when I was in the corporate medicine world, I was always trying to find that work-life balance, right? Like, how do you work and how do you balance life with that? And I remember people talking to me about this idea of work-life integration, like how do they integrate together? And I was very opposed to that statement because I felt like it was another way to kind of push work into your life. I'm like, this is a nice way of saying, oh, it's okay if you're doing charts and watching TV at the same time. Integrate work and life. But I do feel like what I do now is more work-life integration, and the biggest difference is I have so much more control over how and when it happens, and that makes all the difference. What I tell a lot of my colleagues is that yes, you work extremely hard, especially when you're in the system, but you have no autonomy, no way about how much time you're going to spend with patients, how much time you spend doing it. It's all just given to you and dictated to you. And it feels like insult to injury when you're working that hard and you can't go to your kid's parent-teacher conference. That happened to me all the time. And thank God I have a supportive spouse who stood up. But, parent-teacher conferences would be 2 weeks notice. And if I'm booking out 4 months, 2 weeks is nothing, right? And so I could never make these things. And so it made work feel that much more, you just started to feel very hostile towards it because it felt like it was taking things away from you that you deserved to have or that you worked hard to have. So now I definitely work very hard, but I can arrange it the way that works with my life, right? So maybe me going to that, 2:30 teacher appointment means that I see a patient a little bit later or come in a little bit earlier or do an extra phone call. And so it doesn't feel as burdensome because I'm able to make it work with what my lifestyle is. On weekends, if there's a health fair going on, yeah, that's technically work time, but I'm in my community. I'm doing fun things. I can put my son to work. We can do things that make it feel good. And while I still think it's important to draw some lines between work and your home life, I do think when the two support each other and enrich each other, that's really where the magic happens. And that's evolved that idea of work-life integration for me. Of like I can do things that are related to work, but I really like what I'm doing. And I would do this, whether you paid me or not. I love being at this health fair or giving this talk or doing these different things, but I only want to do it as much as I'd like to or as little as I'd like to. So having that control just changes the whole equation.
Someone as busy as you, it feels like, well, what else would she do? And you would be crazy to think that someone who's running a business like this, a mom, a wife, would then also want to become an author, right? And launch a book. She wouldn't do that, right?
Right.
But yet here we
Right.
are. Today is August 3rd, and if
Yep.
you go onto Amazon, if you look for the book, What No One Told Us, it is the top seller or top upcoming release in the menopause category, which is
Yay!
huge. It is
Huge.
huge. What made you wanna bring this book to the public?
Oh my gosh. I feel like I'm sometimes the most overwhelmed person that can't sit still. That's one of my new mantras. It's like I still have a lot on my plate, but there's so much I feel like I wanna do and give to the world. You learn that life really is short and there's you just don't wanna waste the time that you have. And I've always wanted to be involved in these projects where I help and I teach. Teaching was probably the other career I was going to pursue outside of medicine. I was like, I really enjoy teaching and I can only do it one patient at a time in the room. But if I can write this book, I can spread a message to so many more people. And again, it was serving the problem that I had that there are so many Black women who feel so unseen in the menopause space. So I'm so excited that we're now finally having the conversation about perimenopause and menopause and offering treatment. But almost always, as something new comes into medicine, those disparities start showing up again, where marginalized communities don't really get to be a part of that conversation. And there was a part of me that kept waiting for someone to step up and do it. I'm like, ooh, maybe Oprah will find somebody, or maybe just waiting for someone to do it. And finally telling myself, well, Michelle, why don't you just do it? You have the information, you've taken the time to understand, this audience really well. Like, why not let it be you? And I do think when you're on that entrepreneurial journey, you have that mindset shift of like, why not try it? What's the worst that can happen? Okay, maybe only one person buys it, but are you really harmed in that process? And I was like, no, let's just give it a try. Let's just see what happens. And it's been in my head for over a year. And I was glad that we had this encounter that you and your company were able to help me bring it across the finish line. And so the process, again, was part of that work-life integration. It really augments the work that I'm doing. It helped me build other relationships, another skill set, like all those things that just make me feel so good about the work I'm doing and brings excitement into my work. There was one point in medicine, I think a lot of doctors get here, where when you are on this track to become a physician, there's always this next milestone. Get into med school, done, get past your step exams, done, get into residency, done. There's always these check marks, these things to look forward to. When you start seeing patients, you're like, okay, I'm doing this in year 1, year 2, year 3. What's my next milestone? What am I going to do next? Is this the end? Oh my gosh, this feels awful. Like what else, what else am I working towards? And so sometimes I'll put these things in my life that I want to work towards that, it's not external. I get to choose it, but it feels like another milestone that I get to accomplish of I want to write a book. And here it is. That's my book. And I'm excited. And those types of things help drive me forward. So even though I may not always have enough time to do it, or I'm sacrificing some other things, so worth it because it's so fulfilling, not only personally, but also to the lives I'm able to touch with that work. That book has barely been out for 2 months, and the feedback I'm getting has been incredible. And one of the most exciting things I got was there was a Black woman in Australia, of all places, who was like, your book has changed my life. Here I am down under. There's very few people who look like me here and understand what I'm going through. And while the American difference is experience is a little bit different, I feel seen. And here she is a world away from me, and I've impacted her. There's not a price you can put on that about what that does to my life story. Like it's just worth it every time.
I literally have chicken skin right now, like that. Like that's
It was
so
so exciting. Yeah, like you just don't know what's gonna pop up, those are the things that just make it so worthwhile.
it's incredible. So I always like to end my conversations with a question like this.
Mhm.
Say there were a Black woman that's listening to this that's really struggling with their health and dealing with the healthcare system. What do you want to say to them?
I think the most important thing to say is that you are not alone, you're not crazy, right? Because I think there's so much gaslighting that happens in healthcare where you really question whether you're the problem. And that's a scary place and a lonely place to be. So you're not alone, you're not crazy. The second thing I'd say is if you can get with a Black primary care provider or provider, do it. Does it always pan out? No. But what we've learned is that the more culturally concordant care, the care can be better. And I reference this in the book. There was a study that showed newborns who were cared for by Black pediatricians actually had better survival outcomes. And they can't even talk to the doctor, but there's something about having a cultural connection that helps make a difference. And so in that situation, your Black identity is something that's important to you, but it's not just about racial identity. We find this for people who are LGBTQ, like going to a physician that understands and is part of the community, like just being culturally connected makes a difference. But if you can't connect with a physician that's culturally connected, look for someone who is open-minded and willing to listen. And how do you find that person? I think the best way is to try to ask people around you who've had good experiences, right? It's kind of hard to interview doctors yourself and you read up as much as you can, but who has had a great experience with a clinician that you can go right behind them and take advantage of that experience as well. So that person may not always look like you, and that's okay too. I've made great alliances like with you, with people who look nothing like me, right? But there's a lot of magic that can happen in those encounters when you're meeting from a common place and you understand each other. But yeah, I'd say the first thing is you're not crazy. There are a lot of things stacked against us in the system, and it's okay to recognize that. It's okay to seek out somebody that's in your community because that's where safety often happens. But if you can't, there are strategies to look for people where you can still be safe.
Dr. Cooke, I can't tell you how much I appreciate you. You truly are a light within the healthcare and beyond, ecosystems. And it's so cool to see the impact that you've already made. And I'm so, so excited to see what's in the future. But I hope that we can continue to have these conversations, and continue to, challenge the way that we approach health and the way that it's
Right.
delivered to patients. And ultimately just give people more human-based care where they can just feel good about it. So I so
Right.
appreciate you.
Same, same. Well, thank you for everything you've done to help me amplify the message, right? Because there's still so much I don't know how to do, but bridging those gaps of like, how do we bring a book to being published was just enormous. So I really appreciate everything that you're doing as well.
You got it. You got it. And if you are listening to this, make sure to go to Amazon, look for What No One Told Us by Dr. Michelle Cooke. Get your copy. It's an incredible resource. And until next time, thank you. Thanks for listening to the MedStory Podcast, where we share the stories of the greatest minds in science and medicine. I'm your host, Spencer Locke, with a special thanks to our executive producer, Shina May. Our music comes from Blue Dot Sessions and the Descript Audio Library. The MedStory Podcast is made possible by MedStory Studios and listeners like you. So if you'd like to support us, please leave a review. It means more than you know. And if you have a story to share or want to produce a podcast of your own, reach out to us at info@medstorymedia.com. We'll see you in the next episode.